To other stories now, because stigmatization is threatening the Ghana Education Services school re-entry policy for pregnant adolescent girls and adolescent mothers. The policy is aimed at ensuring that the girl child attains her full potential by returning to school with or without pregnancy or childbirth. Even though local school authorities are doing their best to sustain the policy, poor community support is slowing down the expected outcomes. JoyNews' latest documentary, dubbed Girls.School.Pregnancy, produced by Emefa Atiamoeli, details how some girls in the Akachi North District of the Volta region are braving the odds to get their lives back on track in spite of their current conditions. Here is an excerpt.
"16-year-old Mercy Mori is 8 months pregnant for a 22-year-old neighbor. Sadly for Mercy too, the boy who impregnated her is not financially independent. Mercy says, beyond the mockery she suffers from her mates in school, her father always threatens to throw her out of the house at the least provocation. Her mother, however, always comes to her rescue.
School I'm going to like I like me never school home view no ta itenye tomo va chuchodo. Ma macho kaka no nyoba no mojiva kumatra school.
Okay, you won't study.
No mat is dosro where.
Okay, you have a does.
Time do ha I like no nyakpo fufunyo no ta wani banata mo wana no monona nhaha mavi.
Like uncle or parents on one now.
Like abanya ba father fear. Blona na gado ma fear. Na magbenya le fear ko blog ba. No nyoba anya manyo we nya gafa ma. Bloto von anonya na no nya hagboni ba. Mo ma hiata na jogo blog ka gogo ne ba. Anonya na nyimo fufu blota.
Doreen blames her current predicament on negligence on her part. Ameaka do flower a galaxy or thing gava board of Yagina or Nelgiva. Come on, driving a code in it.
When you might work when I got
a mount. A tag banuka and structure for mamma.
Now, you came a shrine, but now never match low bring an amia meow deji.
Among strategies government is employing to reduce teenage pregnancy is the introduction and scaling up of education on adolescent sexual and reproductive health. Despite these interventions, a number of these adolescents still ignore the preventive strategies because of misconception and sometimes lack of access to these services. According to the 2017-2018 Multiple Indicator Cluster Survey, quote, adolescent girls are more likely to have ever had sex than adolescent boys, with 1 in 10 having sex before the age of 15 as compared to about 1 in 14 boys. Out of this number, only a minority have their contraceptive needs met, unquote. The study further states, quote, the majority of adolescent girls who have had sex do not use any method of contraception, with levels consistently low across the areas of residence and household wealth. Those who do use contraception are 3 times more likely to use modern over traditional methods, unquote.
Is tonight, 18th October 2022 at 6:30 p.m. on the JoyNews channel, and that's DSTV channel 421 and GoTV channel 144. Don't miss it. But joining me in studio is the Director of Girl Child Education at the Ghana Education Service, Madam Benedicta Seidu, with more. Madam, good morning. Thank you so much for your time.
Good morning.
Right, now let's talk about the issues raised in the documentaries. You're familiar with these issues, how girls are ostracized once they are pregnant, and they're not getting support from their parents. Let's delve into this. So we've also observed that some of the boys don't take care of them. Yeah. So how does the girl and her family survive in such a situation, particularly when the girl wants to return to school?
Thank you very much. When the girl wants to attend school or go back to school, it is a collaboration between the school and then the parents. In the first place, when she gets pregnant, the school has to be told.
Yeah.
But it will even surprise you that some pregnant girls, it is the school that notices that they are pregnant. Their homes are not even aware. So whatever it is, there's a discussion for the school to know when the girl is going to give birth, and then the parents are taken through the re-entry guidelines, and the need for the girl to come back to school or return to school, and then the need for them to support. So even before the girl gives birth, the parents are aware of the kind of support they should give to the girl to enable the girl go back to school. It is the girl who returns, and normally when she gives birth and all things are going well, in 3 months' time she has to return to school. And then the parents will have to get somebody to take care of the baby. If she has a mother, the mother takes care of the baby. She hasn't got any family member could come in and take care of the baby because she returns to the school alone without a child with her. So this is the situation.
So now what are the parents saying? Because most of these parents, when we're listening to the documentary or watching the documentary, most of the parents are the ones that are pushing these girls to these either older men, older gentlemen, so that they can come out of poverty, right? But the GES is putting in so much effort to make sure that these girls stay in school, whether they are pregnant or not, whether after childbirth. So what are the parents saying about all of this?
I would say it is ignorance. They attribute it to poverty. But it is when the girl completes school and finds work doing that, we'll be able to bring parents out of the poverty. So we continuously do community sensitization. And we believe that one day it will go down with parents. Those who push their daughters into going to look for men, I don't think that is the solution, because it is parents who care for children and not children rather caring for parents. So no matter how poor these parents are, I don't think it is in the right direction to tell the girl rather to go out and sleep with men and bring money back. I think that is not the right thing to do. And the community leaders, our chiefs and stakeholders around will have to take this up and ensure that parents, no matter how poor they are able to at least give their children their basic needs. We are not asking for bigger things. Basic needs, at least food, shelter, clothing. And also ensure that once a girl steps into a school, she completes, because don't forget, in Ghana, education is free. And when a girl steps into basic one, government spends money. So when she gets to midway and she stops, it means the money government has invested in this girl is going to go into the drain. So once they step into basic one, we want to see them progress until they complete. And they will get to senior high schools and perhaps get to tertiary institutions and become the women we want them to be. The first-class women we want them to be, the career women we want them to be, the professional women we want them to be. The markets are full. When you go there, don't you see that it's only women who are there? Men are also part of us in society. Why is it that they are not in the market and we have to be there? Selling the charcoal, the money and others. We also want to become career women, want to become the professionals and also rub shoulders with the men. And it is education that will promote this. So those who think they are poor and are pushing their daughters, today, I am saying it that it is their daughters that will bring them out of the poverty. So they should just support them with their basic needs to enable them go to school. Because these men they push them to, when they impregnate them, they run away and leave them. They don't support them anymore. You see, and that is not what they should be doing. We cannot use these girls as, I don't even know what term to say,
like some sort of
money generating. I mean, they should be the source of their how they'll get money to support themselves.
Like using them as like money generating
goals. They cannot do that. They cannot generate money for their parents.
But now let's talk about the impact and how successful the re-entry policy has been. How has that gone?
Oh, it has gone so far.
Okay.
You know, before this policy, this is how it looks like.
Okay.
Before it was rolled out in 2017, schools were just using their discretion. So if you have school A, B, C, and D, and a girl gets pregnant, each school will use its own discretion. Now this has come out, and we have streamlined the ways in which girls should be treated when they get pregnant. So like I said, it was in 2017-18. We had 2,720 girls going back. I'm just giving data from EMIS,
okay.
Education Management Information Systems. That is where our data is collected, and then it is authenticated before it comes out.
Sure.
So it's possible other girls entered and then they were not captured. It's possible.
Okay.
But this is through our data collection source. So 2018-19, 3,212 went back to school. And then 2019-2020, 4,937. And then 2020-21, 4,035 went back. So when we look at the 4-year span, 14,904. So all these children would have gone into the drain.
Yeah.
So that if we get pregnant, you can't go back to school, we would have lost all these children to school dropouts.
Yeah.
So this is what is happening. So if you add this year's figures, it's going to go very, very, very high. So I think it is doing well. If you tell me to assess it, I'll say it's one of the most effective programs GES has rolled out so far, because we are attending to the vulnerable. We are giving them a second chance to go back to school.
Yeah.
We are saying we need them in the classrooms. That doesn't mean we are applauding they've gotten pregnant too. But once that mistake has been made, whatever the reasons are, we are saying come back to school and also complete so that you could contribute your quota to national development. Ghana will move forward based on all of us. It is not just a few people who should be doing it. All of us should join hands. And if we have all of us going to school, completing and becoming professionals, then we contribute our quota to the development of Ghana. All pay taxes.
Yeah.
We all hold one sector or the other of the economy and push it so that we have the development that we've been craving for.
All right, before I let you go, and briefly, do you offer some sort of counseling, or do you offer some sort of like post-talk with these girls? But also, do you offer like a pre-talk with these girls? So if like a 16-year-old is pregnant, obviously we're trying to make sure that she goes to school, all right? So she comes back to school. Is there some sort of conversation that happens with the 16-year-old? But also, is there a conversation that happens with the 14-year-old girl who is not pregnant yet, but who has seen the 16-year-old pregnant and thinks, okay, maybe it's not a bad idea. Maybe I can, fall in love with a James, and James will give me money, and then I'll come back to school. Are these conversations taking place?
No, I'm glad you've asked this question. We give them counseling, a lot of counseling.
Sure.
We have coordinators, regional coordinators, district coordinators, and coordinators in the schools.
Yeah.
So we give them counseling. You see, re-entry does not take away the troubles a teenager goes through when she gets pregnant. So re-entry alone is just bringing them to school, but she will face the consequences of getting pregnant very early.
Yeah.
So when she comes back, she even becomes a source of counseling the others. She will have to tell them how she got pregnant, how society was against her, how her parents got angry with her, how she could not even attend antenatal because she didn't have a husband or money.
Yeah.
She couldn't eat the food required of a pregnant woman. The difficulty she went through giving birth, some of them will have to go through cesarean section because they got pregnant prematurely. They were not yet fully grown and so on. Having a baby sack, getting up late to feed babies, urinating and easing on them, crying, and they'll have sleepless nights, all those things, and having to study having a baby.
Yeah.
So the re-entry alone will not take away all these troubles. So when the girl goes back to school, she should know that she will still have to face the difficulties that a girl will have to go through giving birth prematurely.
Sure.
So those who are afraid that re-entry will promote girls getting pregnant should be rest assured, because we make them know that early pregnancies are bad, and there are so many troubles waiting for those who get pregnant prematurely.
Sure.
Yes.
Thank you so much, Madam Beatrice Siedu, for that. You're doing a very good job, and I hope that, next 2 years, we won't be having this conversation, because we would have made sure that this problem is done away with. And that is Director of Girl Child Education at the Ghana Education Service, Madam Beatrice Siedu. You're still watching Joy News Desk. Up next is business.